Hi, I'm Rich Brown, Clinical Director of the Wisconsin Initiative to Promote Healthy Lifestyles, or WIFL. WIFL addresses risky and problem drinking and drug use by helping clinical settings implement evidence-based SBIRT services, screening, brief intervention, referral, and treatment. Our clinical partners include primary care clinics, emergency departments, and hospitals in urban, suburban, and rural settings throughout the state of Wisconsin. Many randomized controlled trials have shown that SBIRT services decrease risky and problem drinking and drug use, improve health outcomes, decrease health care and other costs, and maybe even save lives. Typically, patients complete written questionnaires in waiting areas. Clinical staff review those questionnaires and ask certain patients to see on-site health educators. WIFL trains and supports those health educators in delivering excellent evidence-based SBIRT services. We found that this model is effective in addressing a variety of behavioral health risk factors such as tobacco use, unhealthy diet, and depression. Altogether, these kinds of risk factors are responsible for over 40% of deaths in the United States. At this point, I'd like you to hear from a number of stakeholders in our healthcare system who are very familiar with SBIRT and are convinced of its power to save both money and lives. We will end by hearing from our patients, people whose lives have been changed by SBIRT. I find that these patients are the best reasons for us to try to systematically implement SBIRT services in all of our clinical settings around Wisconsin and the nation.
This is something that we must do, we have to do, and we should have done a long time ago. Is this a public health crisis? It certainly is. Has it been a public health crisis? We have a former commissioner in the back, Paul Nannis. On his watch, it was a public health crisis. It continues to be the case in Milwaukee. Alcohol and drug misuse is a major public health concern. I believe that SBIRT is clear as the sunlight. This works. It's been proven. It will work. And I'm happy that it's being implemented right here on the ground. And as Commissioner of Health for this city, I'm glad to see that there's a push to have this replicated and to have this expand.
Public health and public safety are the exact same thing. Why do I know that? I know that for a fact because we simply cannot afford to simply react to problems, and we have a host of problems in our community that need desperate attention. And the only way that we're going to affect those problems in any meaningful way is if we in the law enforcement community adopt a basic public health model to our problems. And that means that we have to, first and foremost, commit wholeheartedly to prevention. The vast majority of the people that encounter the criminal justice system encounter it under the influence of alcohol, under the influence of drugs. Many of them have mental health issues that cause them to keep coming into the system again and again and again.
What the WIFL project has brought to us, what our health educators being in our clinic has really brought to us, or myself as a clinician, is the knowledge that even when time doesn't allow me to pursue that question, I might ask it, but I might ask it quickly enough that maybe I'm not as welcoming to the answer as I need to be. And once I hear the answer, sometimes I don't have the time to go into a long discussion about the consequences of that use or the answer that I've been given. But having a health educator in our clinic has really helped us to relax in knowing that our patients are being taken care of.
This particular program is something that is just a win-win-win-win-win-win-win across all the domains, across all the collaborators that are at the table. This program has a positive economic impact and results in net savings to our healthcare system and to purchasers and to our employers. There's a decreased cost of care. It improves the way we provide the care, and again, it also improves the health of our community.
We know that most people in America, most people in Wisconsin, visit a healthcare setting at least once per year. So just as Dr. Brown said, we expect when we go to the doctor that our blood pressure is going to be checked, our weight's going to be checked, we're going to be asked a few, we hope we're going to be asked a few, sort of risk assessment types of questions. SBIRT ought to be on that list. We need to make sure that this is literally baked in and made a routine part of the way medical practices operate all across our state. The good news about this is that even in the historic, fiscally difficult times that we face, even in a time where I can tell you as a department head that new dollars for anything in this last state budget were in very short supply, and there were many, many great programs that I went to the governor with and said, Governor, if we could just have a little bit of money to do this, it would be great. Didn't get many of those requests, but this is one that I did. So this is one where when we went to the governor and said, Governor, this works, it addresses an important problem, and it absolutely is one of the best uses of our money that we could possibly make. The governor was fully prepared to endorse it, included the expansion of SBIRT in his budget that received the support of the legislature. And so we were able to plan to begin to expand SBIRT services to the entire Badger Care Plus Medicaid population.
I was very interested in the SBIRT program from the payer perspective, and I said that it seemed to be very much in line with the goals and the objectives of our healthcare cooperative. The first question we ask is the service or the procedure that's being requested likely to improve a health outcome? And if the answer to that is yes, then we go on to the second question. Is the way that this service being provided or offered the most cost-effective way that it can be provided? And if the answer to that is yes, then the third question is it legal or is it a covered benefit according to the plan that has been purchased by whomever bought the insurance policy, the healthcare coverage policy? And when we looked at SBIRT services, when Rich and I looked at SBIRT services, it got a resounding yes on the first two. Unfortunately, when Rich and I met, the third was no. We didn't have codes to pay for these services. We didn't have a good way to promote this, to reward the provider community that was willing to do this. But I'm pleased to say that that not only through our work with the department, we'll be covering them for all of our Badger Care members, as you heard earlier, but we'll also be loading those codes into our claims payment system, and the same service will be extended to our 25,000 commercial members as well. It just makes good sense.
Controlling costs is our mission, and we believe that the cost of care is a result, is impacted by the quality of care delivered, the utilization of resources, as well as, of course, unit costs. Alcohol and other substance abuse has multiple cost implications. It's not just the cost of the health care. It's the lost productivity in the workplace. It's the safety issues that arise through these issues as well. And then just the general impact on the family is unbelievable. And it's critical to addressing these costs is the early identification and then intervention. And the healthcare delivery community must make this early identification available, and they must make this part of their delivery system. And the business community must support that transformation. So we believe that SBIRT offers the most promise to do this. SBIRT is a value-based initiative, and that's really what we're looking for. We're looking for value. What does that mean? It means that the money we spend is worthwhile.
You are on the cutting edge of something very, very important. And when we're talking about healthcare reform, especially when healthcare reform has been discussed in Washington now and has become very, very partisan, what you're talking about is something that can lead to a very strong bipartisan consensus to get something done. Earlier this year, many of you were part of the effort that passed the comprehensive statewide smoking ban in Wisconsin, which was a great, great accomplishment. And what you're talking about today can bring together many of the same players and many of the same dynamics that we used to pass the smoking ban.
Because of Christina and our being able to partner regarding patient care, there's a high school teacher whose cholesterol is now very well under control because she's no longer drinking. Not, again, wouldn't qualify for alcohol abuse or dependence, certainly, but she was having alcohol use that was having a health effect on her. Because of Christina and our team approach to care, there is a child psychotherapist in town whose sleep disorder has completely resolved and her mood is excellent because Christina was able to have a conversation in a way that I wasn't. She was able to connect with this person. Because of this program in Christina, there is a young father who's 18, who I've cared for since he was in preschool, who has not had any missed days of work due to illness or injury since we got him to stop drinking.
I was drinking every day, at least up to 6 beers a day, if not more. And then the pills, whatever I can get, whenever I could get, just so I wouldn't feel any pain anymore.
I was drinking heavily, almost every day. Waking up with hangovers, tired from work, didn't want to go to work because I was hungover. I was using marijuana.
I would have 3 to 4 drinks, starting with dinner, and I wouldn't stop until I went to bed.
The professional help in my doctor's office was nice because I didn't have to go to a different place that I don't know. I was comfortable in my own setting.
Chris Kapner coming to the doctor's office one day. When she came in there and got to talking to me, it was like it motivated what I was feeling already inside about the alcohol and smoking the marijuana, you know. I pretty much already knew where I stood with the alcohol and the drugs. I just didn't know how much it was damaging me. I cut down over half of what I was doing when I first started talking to Chris. I believe it was 2 to 3 times that I met with her. So it just stuck with me. It didn't take me to keep coming in or to keep calling her.
My health educator helped me by giving me the healthy lifestyle guidelines for drinking. So I started with that, and I wrote it down on the calendar, all the drinks that I was having, and it was a real visual picture. If I hadn't gotten help through Wiffle, my life would still be drinking every day, headaches in the morning, sluggish, the pattern over and over.
If I hadn't received help or talked with Chris, I believe right now I've been lost my job right about now. Wouldn't be able to pay my bills. They done took my car from me. So it changed a lot. I would have lost a lot of stuff if I hadn't talked with Chris.
I would be dead. I'm sure of that.
You can't turn the TV on or pick up the newspaper without hearing about healthcare reform. And for any meaningful healthcare reform to take place, everybody has to change. Everybody has to do something different. The payers have to do something different. The providers have to do something different. Employers have to take a different role in the health of their employees. And patients and members have to behave differently. I think there's a lot that we're going to learn about collaborative care services like SBIRT through these kinds of programs that may be a guiding light for us as we try and move forward with healthcare reform.